Parkinson's disease is a progressive neurodegenerative disorder that affects the control of movement due to the loss of dopamine producing neurons in the brain. As the disease progresses, you have shorter arm swings, freezing of gait, so start freezing in between step, which increases the risk of falling and or tripping.
So type 2 diabetes is a chronic metabolic condition where body becomes resistant against insulin, meaning glucose or sugar stays in the blood instead of moving to muscle for energy. Over time, that can raise the risk of heart disease, nerve damage, or fatigue.
Okay. So we have Nordic Walking as my example. So basically, Nordic Walking is walking, but with specialized poles, as in cross-country skiing. So as of right now, I have these two poles. Granted, these are not poles that are specifically designed for Nordic Walking, but I will just demonstrate. So basically, what you want to do is have your hands out like this, your posture in a neutral spine position, your body upright, and when you swing, you go alternate with your foot. So this is not supposed to slip, but it is slipping. So when I demonstrate, I go across and push, across and push, across and push. Okay?
Yeah.
So this will help the body do a full body routine. So it's engaging all of your muscles, but it also helps with the motor complex. So it works both your cognitive and motor functions.
So HIIT stands for high intensity interval training. It means doing short bursts of hard effort followed by quick, brief recovery. So for an example, you might want to work hard for 30 seconds, then rest for 30 seconds, then you can repeat it for several rounds. HIIT can be done using body weights, quick drills, and resistance exercises. So for the demonstration, we'll be doing 3 exercises for HIIT. So we'll be doing marching in place. So it's like squat marching. Okay. Then we'll be doing squats. Then step back lunge. Okay. Of course, we'll be having rest in betweens. So you can do it for like 30 seconds each. But just for the time constraint, we'll be doing it for 5 seconds. Okay. So squat marching. Yeah. You can do it like alternate hand. Yeah. So just make sure your spine is right, neutral. You're breathing naturally and normally, and brace your core. Okay. And for 5 seconds, then resting for 5. Okay, you can stop now. Okay. Then you move on to squats. Of course, for 5 seconds rest. Then moving on to squats. Like naturally, you don't have to go all the way down. Just keep your natural squat position. Yeah. Just slow it down. Brace your core. Breathe naturally. Yeah. Perfect. Okay. Then we'll be moving on to the next one. Resting for 5 seconds, of course, again. Then step back once. Okay. Perfect. Slowly engage your core. In case you find it difficult with your balance, you can always use the chair or any wall for the support. I will do it one more time. And perfect. Thanks.
Okay, so Nordic Walking, there are many researches that show, especially from Van Eikeren and Hazel Montero, that there is an increase or a positive reaction in their walking speed, their balance, their stride length, and quality of life. But there's also some recent research that found increases in brain-derived neurotrophic factor, which is the BDNF. It's a protein that supports neuroplasticity. So here it helps rewire the brain and strengthen it so it can adapt to the new movement pathways. So in short, there is a physical and neurological adaptation from Nordic Walking that helps benefit it in Parkinson's disease patients.
For HIIT, several studies support using HIIT for people with type 2 diabetes. So like Cassidy in 2017 found out that HIIT significantly improved blood glucose regulation and also cardiovascular fitness. Also Taylor in 2019, along with other studies in medical and sciences in sports and exercise, found out that using HIIT significantly lowers HbA1c, which is hemoglobin, also improved blood insulin sensitivity. So for concluding all this, HIIT is one of the best training method for lowering blood sugar level and also improving cardiovascular fitness.
Some safety considerations for people with Parkinson's disease that want to do Nordic training. Basically, the first one would be your pole length and your surface. You make sure your surface is not too slippery and your pole length is just right for your person. Number 2 would be the timing and fatigue. So making sure that when you're on your medications, you're still not feeling too well, I strongly advise you from doing Nordic Walking. Third one would be postural awareness. So making sure your body's upright, you have a neutral spine position while doing the Nordic Walking. Fourth would be supervision, making sure that during the early stages of Nordic Walking, you're having supervision just in case of falls or even like trips. And lastly, footwear. So footwear, non-slippery shoes. Basically, Nordic walking is not just walking, but it's basically full body exercise that's going to help benefit a person's movement pattern that has Parkinson's disease, how they live better, and they can live independently.
So for safety consideration for people with type 2 diabetes, doing HIIT, always check blood glucose before and after workout to avoid hypoglycemia. Have fast acting carbs like juice or glucose tablet nearby. Wear safety shoes to protect your feet and avoid any hard impact activities if you have neuropathy. And also, basically in general, have a shorter duration of exercise in the beginning and gradually, progressively increase the exercise as you improve your fitness level.